This is Living Healthy with Jackie Bell, the show with the information on health that you need to know from people you can trust. Brought to you by the woman in you.
Hi, welcome to Living Healthy. I'm your host, Jackie Bell. Many of us are living our lives worried about breast cancer, when really we should be focused on breast health. Today's show is called Natural Breast Health, and with us is Dr. Dawna Jones from Bella Natural Health and Gynecology in Hanover, Mass. Dr. Jones is a board-certified obstetrician gynecologist specializing in natural therapies for menopause, hormone balancing, and women's health concerns. And we'll be discussing natural concepts for maintaining the health of the breast. Welcome, Dr. Jones.
Thank you, Jackie.
Thank you for joining us again. Again, the approach that I'd like to take about breast health is really not to focus on the statistics about breast cancer and to join in the crowds that are already doing their work to find a cure for breast cancer. And what I want to steer towards is breast health and what we can be doing to stay healthy and what you do in your practice. You have a private practice, you're a holistic gynecologist and a homeopathic physician. And so your approach is going to be a lot different than the mainstream allopathic approach, but you can bridge both worlds into an integrative approach. So tell us what it's like for a typical person. I'd like to talk about two different patients.
Okay.
The one patient who's healthy, how do you keep her healthy? How do you help her keep her breast optimized? And then for the patient who has breast disease or tends towards a breast disease, maybe has fibrocystic tendencies or has found a lump and is being treated by a specialist like an oncologist. So let's do the healthy patient first. How do you optimize someone's breast health? What's your approach?
Generally, when people come into the office and we're talking to them about their general health, that will include their breast health. And so we're going through a history with them. We're finding out what they're doing with their diet and nutrition and whether they're doing a breast exam. I still think it's important that everybody do a breast exam once a month, because those women who are more familiar with their breasts are going to be able to detect changes in their breasts sooner than the yearly visit when they come in with us. There are certain foods that are protective for the breast.
What would be examples of those?
Well, you know, it's interesting. There are foods nutritionally that we can eat every day that are protective for the breast, and the more common one that I talk to people about are cruciferous vegetables. So those are the vegetables that include broccoli, cabbage, bok choy, Brussels sprouts. There's an ingredient in them that actually decreases activity in the breast for abnormal cells. And so it helps the breast to stay healthy. It helps to clear toxins from the breast. The other thing that's easy to incorporate into the diet is flaxseed or flaxseed oil, which has a component in it that binds to the estrogen receptors, or the little antennas that are on all of the cells in our body, and helps to protect that from being overstimulated by estrogens that are either too strong or things that are not supposed to be there that look like estrogen, like pesticides that came in on our food or hormones that came in on our meat. Or
the plastics.
Right, or the mimickers in the plastic bottles that people have been talking about, the plastic that gets heated up and ends up in our cells. And so in talking to people about nutrition, that's probably the biggest thing, helping them to learn how to examine their breasts, helping them to talk about nutrition and diet, the exercise, trying to keep or maintain a normal body weight will also be helpful, because many of the toxins that are in the body are fat soluble and they sit in the fat, and the breast has a large amount of fat in it. And so we do things to minimize their exposure into toxins, chemicals, activities that can be harmful for their general health and their breast health.
And so how does hormone balancing play in, or how is hormone balancing a factor in maintaining a person's breast health? Do Do you find that a woman might be estrogen dominant is going to tend towards breast disease as someone who isn't? And how do you help to optimize someone's hormone balancing for breast health?
Well, what's interesting is as women, when I'm listening to people describe what's happening with their menstrual cycle, it's also giving me clues as to what's happening with their breast. So in women who are having very heavy bleeding, or they're having cycles that are irregular, or they're having painful sore breasts, that gives me a clue that they may have a lot more estrogen on board than progesterone. So they have some imbalance in their hormones that's overstimulating their breast. And one of the things we like to do with that is to try and help them to metabolize their estrogen faster. So you can do that by increasing fiber. You can use that, the flaxseed or the flaxseed oil that we talked about in the cruciferous vegetables. There's also a component in the flaxseed that is going to rebalance their hormones, and DIM is another extract that comes from broccoli and cabbage that will help them to metabolize their estrogen quicker. So in eating the right foods, they can balance that out, and that will help their breasts to be more comfortable, but it'll also keep their breasts from being overstimulated. So the breasts are made of fat and glandular tissue, and it's the glandular tissue that's being stimulated by their hormones that's causing them to be uncomfortable. If you have constant exposure of the breast to estrogen without having the balance, there's also the potential for that glandular tissue to become overstimulated. If you also have toxins, say for example, you're someone who ate lean cuisine or a microwave meal every day and microwaved it in the plastic tray, some of the traces or residue of that plastic may be there, and that in turn may cause some damage to the DNA in the cell. So you have a cell that is damaged, and you've also put a lot of estrogen in there, kind of fueling the fire.
Right.
And that in turn may cause some concerns.
And what about women who have had maybe a hysterectomy or, an ovarian cyst or something like that? Are there ways, do you think that those people tend to have, or say the uterus is gone and they're not having a place for estrogen to go and to be utilized, is it going to be distributed to the breast? Do they have a higher chance of developing breast issues?
Well, it's really interesting when you talk about the hysterectomy, because the hysterectomy is just removal of the uterus itself, but they may still have their ovaries intact, and that's really where the estrogen and progesterone are coming from. So even though their uterus is gone, they still have the same hormonal milieu that's affecting their breasts. So they still have the estrogen dominance or the estrogen fueling everything.
Okay, so, and do you do hormone testing? How do you test for hormones?
We can do hormone testing in women who are having their periods. It's not useful to do the blood testing unless you're doing it at a certain time of the month, because the hormones are always fluctuating. And so many times we are measuring the estrogen at the beginning of the month to see what's happening there. A lot of times we're trying to find out how much ovarian reserve they have. We're measuring the progesterone later in the month when it's peaking to see if the levels when it's peaking are normal. You can, with saliva kits, actually measure the estrogen and progesterone levels throughout the month. So they would take the kit home, and about every 3 days they would fill a tube of saliva until they had done that for an entire month. The specimens remain frozen until they're ready to ship them off, and what we'll get from the lab is they will plot out what has happened with estrogen and progesterone throughout the month. They'll tell us what the ratio is and what the possibility of abnormal proliferation of the breast is.
And then from there you'd know how to treat someone, whether it was just with diet regime or supplements or
Yeah, it's
homeopathy
interesting because I've already taken a history, so it may not really change what I'm going to do, but I can show the patient what's going on.
Mm-hmm.
You can show them that this is a map of what you've done through the entire month. But many times I've already started the regimen. I think from listening to women for so many years and coming up with ideas on what to do, I pretty much have a protocol in my head of some basic things that are going to help them.
Okay, so you cover nutrition, nutritional aspect, their hormone health, along with any history that they might have, how their menses has been,
and
so
this may
forth.
also, what may be important is their family history as well. If I have a patient who comes in who has a first-degree relative, a sister or a mother who had breast cancer, but particularly with a sibling, there are things that we're doing right away that are going to help them to protect their breasts and that are going to be preventative. And so I won't let them leave the office without having that information. They know exactly what they need to do.
And what about iodine? Iodine helping the breast health or keeping your breast health optimized. Do you find a lot of women are low in iodine?
When we started measuring it, both the iodine and vitamin D, I'm finding in many of the patients that we have that live here in the Northeast are low, and both of them are key factors in breast health. And so there's an optimal range for vitamin D that helps to protect the breast, which is usually 50 to 100. Most of the labs, they'll measure normal as 30 to 100. And I have women who come in who are 8 and 16, who are lethargic, having problems with their skin, but also they're having problems with their immune system, which can impact negatively on their breast health. As far as the iodine goes, one of the reasons that they had put iodine in salt in the last century was because there were areas of the country in which iodine was lacking in the soil, and so they weren't getting it in their food. And so we don't see as much of the iodine deficiency, and therefore people are not tested regularly. But I still find subclinically that we have people who are coming in who are iodine deficient, who are growing a goiter, or they're having some enlargement of their thyroid that's really related to iodine deficiency. So when I hear that, we may go ahead and test their iodine levels. If I hear that there are related histories of fibrocystic changes in the breast, or ovarian cyst, or cyst on the thyroid, all of those together sound like it's possible that they may have a lower level of iodine. And so they may be supplemented with that.
Okay, so that and then also the monthly exam that they should be doing on themselves.
And we go over that in detail so that people have a comfort level. Because part of the problem is that they may not have been shown how to do their exam. They're not comfortable with touching their breast. But there really is a lot of benefit not only to doing the exam, but doing skin brushing or massage of the breast on a regular basis to help the lymphatics actually clear toxins out.
Yeah, I find that too, that the breast tissue, even if you tend to have dense fibrocystic breasts, that it becomes more supple, more softer, less achy. If you massage your breast every day, you're getting better circulation in there.
Right. So
Yeah.
that's part of the issue that comes up with wearing a bra or wearing a bra at night, that it does decrease the lymphatic flow. The elastic that goes around the chest wall on the breast will actually decrease the lymphatic flow the longer you have the bra on. And so women who keep on their bra more than 12 hours a day actually increase their risk by 6 times if they also have irritation or complaining of irritation from the bra.
Like a red marking or indentation in the skin, and you know it's too tight.
And so you can decrease that risk by breast massage and taking off your bra at night.
Yeah,
Simple
as
things
much
you
as
can do.
possible. Now, what about the patient who comes in who has a diagnosis of a breast disease? How do you work to optimize their health and help them through this so that their body can heal from it?
We have some women who are coming in after they've been diagnosed with breast cancer, or they have a first-degree relative. So those women who are coming in who have a diagnosis or who already have been treated, we want to do things that are going to optimize their immune system and help to make their body more vigilant for any abnormalities. One of the things that you can do is to make your body more alkaline. Usually your body wants to stay at a certain pH level. A more alkaline pH will discourage cancer cells from growing. And in fact, they did studies that show that cancer cells will not grow in an alkaline environment. So some of the things that you can do is making sure that you're getting 5 to 7 servings of fruits and vegetables a day. You can also take a green drink. That could be barley grass, alfalfa, chlorella, pulverized green vegetables. The green drinks and the fruits and vegetables will raise the pH in the body. If you're under a lot of stress, if you're eating a lot of processed foods or animal proteins, those are the things that will create more acids and lower the pH of the body. One of the other benefits of having a more alkaline pH is you're less likely to pull calcium out of the bones to buffer the blood, because your body is going to do that to help maintain the organ systems. So we start with the pH and we're looking at the diet. We're also making sure that they are on the flaxseed, the DIM, and the cruciferous vegetables that we talked about. We may use certain herbs that are considered to be blood purifiers, like burdock root.
What would typical herbs like that be, or is that maybe the top few that you like?
Well, burdock root is one of them. They used to use a tea called Asiac tea. It's still available at the health food store that you can use to cleanse the system. We also use some herbs or vitamins that help to boost immunity. One of them is astragalus. What astragalus will do, and it's used in Chinese medicine, is it will increase your natural killer cells. And so those are the little Pac-Mans that go around in your body and kind of chew up the cells that shouldn't be there, or they chew up foreign material. There are also foods that you can incorporate into your diet if you're using a lot of garlic or onion. It's high in selenium, and selenium will help you to make more glutathione, which helps with your immunity and surveillance. And so in doing a regimen like that, you may find that that'll work better. Vitamin C plays a key role in the adrenals in helping with your immune system, as well as the B vitamins. Essential fatty acids, things that your body cannot make by themselves, and vitamins and trace minerals are actually used to help you make energy for your body, but also to help your immune system function properly.
Do you usually find that you can give a person a multi that has most of these things in it, or do you individualize a program for them and what they should?
Yeah. Actually, I like using whole food supplements. So what that would be is that it is a food that has all the vitamins and nutrients and the enzymes in it that your body will need to utilize the nutrients properly.
So like if it includes a whole food cruciferous.
Right. It can be something like barley grass or alfalfa.
Okay.
We talked about that. Bee pollen or royal jelly are some examples. Spirulina, which is a seaweed, as well as chlorella. So I use those a lot. Mm-hmm. And it makes it easy for people because they don't have to worry about taking 5 different things.
Right.
They're going to get all those things in, and I'm more likely to get them to participate in their care.
So you boost the immune system, you work on diet, you optimize their hormone health as well?
Yeah.
Same way?
It's also important, the exercise component. There is one of the things we like to do is to help with lymphatic flow in the body, and a simple way to do that is to use a rebounder or a mini trampoline that you can use at home. The lymphatics are it's kind of a tubing system throughout the body that helps to carry toxins out. And so when you're moving, the lymphatics are pushing the lymph through.
So there's no pump to the system. You have to move your muscles in order to pump it.
Yeah, you're the pump. You're the controller. So when you do that, you're much more likely to also help your body to eliminate toxins. You could also try sweat therapy, which we have people get in the tub. They can use a conduit in the tub. They can use something as simple as a magnesium bath or an oatmeal bath, like a vena sativa, and sweat and things out of their system and have the toxins just come out in the water. We use detox foot baths in the office to also do that and cleanse the liver.
Now, what about the issue around mammograms? Do you recommend that women get a mammogram annually or biannually, or how do you feel about, you know, the controversy about the frequency or the ineffectiveness or even the radiation around the mammograms?
Yeah, there's controversy around the mammogram, but you have to understand that in the mainstream medical community, the mammogram isn't going to go away. And so you have to figure out ways to utilize that, but also have the patient not feel that it's so harmful that they're not going to come back.
Right.
They do have digital mammograms. I tell people that they have mammograms that are assisted by the computer that will that may keep them from having more and more exposure of their breasts.
So
the mammogram does emit X-rays, and you will get some radiation from a mammogram. It's a minimal amount of radiation. However, I tell people to do things before and after their mammogram to protect their breasts.
What do you tell your patients to do to protect
one of the
themselves?
things is they can use the bioflavonoids, a full spectrum vitamin C, along with orange or yellow colored vegetables and deep green leafy vegetables will give them components that will keep them from having breakage of DNA
So
and
should they be on that
minimize
for
radiation.
a week or so?
Right. We usually have them be that on a week before they go in for their mammogram. I tell people to maybe schedule their mammogram within 7 to 10 days after their period starts, not to go in when their breasts are tender, their hormone levels are higher. It's going to be a more uncomfortable exam, and it's a possibility that they'll be their breasts are going to be a little bit more susceptible to changes. I also have people afterwards doing the bioflavonoids, doing the cruciferous vegetables that we talked about, and using seaweeds like miso soup or chlorella or spirulina, which will neutralize the radiation isotopes. So there's things you can actively do yourself to minimize any issues to the breast from the mammograms.
And so you're one of the few doctors who can really appreciate the European thermography approach, which is an integrative approach using thermography which takes skin temperature readings to understand the nervous system and blood flow.
I've been very enthusiastic about the European thermography, and one of the things I've been impressed with is how thorough the exam is. So it hasn't been limited to the breasts. I've been sending people to have their breasts examined, but it gives us a full picture of what's going on in the body, including the lymphatics, how the adrenals are working, how the breasts are working. When we look at the breast, there is a picture that is given to us, and it can tell us whether there's areas of chaos in the breast, areas that we need to pay attention to before they become problematic. So in many of those patients, we may do a regimen of lymphatic drainage, or we're asking them to do skin brushing and the sweat therapy, and then they are re-examined within 6 months. And you'll find that there's improvement, complete change in the thermography. So some of the patients are using that as a regimen to do in between mammography. I have patients who don't want to do mammography at all, and I have been suggesting that they may want to look at an alternative way to evaluate the breast and follow the breast, and the thermography has been very popular.
So as far as other tests for the breasts are concerned, when is it appropriate for someone to have an MRI or an ultrasound? How are they used and why are they important?
The MRI has been recommended for patients in our practice if they have a strong family history of breast cancer and 2 first-degree relatives. They should be able to get an MRI. We just have to put in a request with their insurance company. One of the reasons that the MRI might be a good idea is it doesn't use radiation, but it also may give us a much clearer picture of what's going on in the breast. If I have someone who has had a mammogram and they've asked them to come back in 6 months, and then they had that mammogram and they asked them to come back in another 6 months, I usually stop it there and request that we do an MRI, because the repeated exposure, the radiation exposure is actually accumulating in the breast.
And the MRI uses a dye too, so it's not like you want to do that often either, but it's very, very thorough and very detailed.
Right, and so that may keep somebody from getting a biopsy or having repeated mammograms to look at the same issue.
And what about the ultrasound?
The ultrasound I use if I'm looking for a cyst in the breast. If I can feel something, it's a mass, I want to know if it's cystic or solid. And many times this is a woman who is younger than 40. And so we wouldn't necessarily be going straight to a mammogram. If we find that it's a cyst, then we may treat it more like it's fibrocystic breast and see if it'll go away in a few cycles, doing some of the regimens that we talked about, or draining the cyst if necessary. But the cyst in the breast may be a symptom of something else as well, and we had talked a little bit about iodine deficiency. So sometimes we'll find that the cyst will go away if we change a few things in their diet. There are some women who are offered an ultrasound instead of a mammogram if they have a pacemaker or something that wouldn't allow them to have an MRI or a mammogram. They might be offered an ultrasound. But generally, one of the issues with ultrasound is you may not see a very early issue in the breast. With thermography, you would see something going on, but you may miss it on an ultrasound.
Yeah, yeah. With the thermography, we can tell the heat, we can tell a lot of detailed information about whether it's lymphatic based or endocrine based or hormonal based,
right,
toxicity based. We started the show by saying, you know, many of us live in fear of breast cancer, but it sounds like the holistic approach that you take, where you're really addressing the person, you know, where they are in their life, whether they're, you know, premenopausal, perimenopausal, or
right,
menopausal.
Well, there's, you know, there's a lot of things that are under our control. Many people panic because they don't know what to do to help themselves. They don't know how to help themselves to be healthier or to prevent problems with the breast. And so you kind of feel like a sitting duck, but there's so many things that you can do.
Thank you so much for being on the show and sharing everything about natural breast health with us. For more information on Dr. Dawna Jones, visit bellanaturalhealth.com. You can also contact her at her office number is 781-829-8900. Thank you for joining us today. I'm your host, Jackie Bell. We'll see you next time on Living Healthy.